What's going on, everybody? Welcome back to the Find Your Stay Safe podcast with Kelton and Ashten.
Good morning.
Good morning. We are, today we're going to go through a little more detail, in depth on some of our core philosophies for steady state. We've thought about them, for years and been developing these for years, but we kind of built a framework and we've got 5 major philosophies that we use as the foundation of what we believe in terms of helping people with running. And we'll dig into those, but I think we'll start with a short weekly update over the last week since the last episode. How's your week been?
Well, I'm one more week pregnant.
Haven't announced that we're pregnant yet, but not been not telling people either.
Yeah. Yeah, I just kind of casually tell people when it feels right. Not a big secrets person.
Yeah.
I've never liked surprises or secrets. Just kind of.
So since last week, you had the blood test for genetic testing. 12 weeks, right?
Yeah.
And along those lines, hoping to find out the gender.
Yeah. It's been I will say maybe I don't want to say less exciting pregnancy, but I had a miscarriage in the fall and it's just a different experience being pregnant after having a loss. Yeah. So I think that's also part of the, it doesn't need to be a big thing.
Yeah.
It's just kind of, I am pregnant now and hoping to continue to be pregnant. But yeah, we just had our 12-week appointment and heard the heartbeat for the first time, which was really great because, of course, you question everything. And I think a lot of people do in pregnancy. There's a lot of kind of things to be anxious about and wonder. But yeah, it's in my experience, especially after having a loss, it's tenfold. So
yeah, it's been a little harder to be excited over these first few months.
Yeah.
I don't know if I share this with you or if you know, but during the appointment, I was kind of researching, if things look good at 12 weeks, how are your odds?
Emily Oster has some stats.
Yeah. I don't know what hers is, but
yeah,
I found 1% miscarry after 12 weeks or something like that. So,
yeah. So it does happen, but
compared to, was it 20% of all pregnancies?
More, but a lot of those are earlier than you would really whole pregnancy. But, yeah. But we'll talk a little bit more, I think, at some point about that, because I think there's a lot that people don't know. And even me being in the world of pelvic health and pregnancy and postpartum, I definitely learned a lot by experiencing it. So I think what helped me the most is hearing other people's stories and, experiences. And so I think at some point I would definitely like to share.
I know you've been kind of struggling is not the right word, trying to figure out the best way to share that. So
yeah,
that's coming. I think that would be really helpful for other people too. What is one of so we have for those that don't know, we have a son named Calix. He is almost 2.5. Is there anything over the last week or so, or anything that he's currently doing right now that you are that you love or find hilarious? Most toddlers do such funny things, but
there's so many, but let me choose one. Okay, so it's the snow is melting and there are a lot of puddles, and he cannot see a body of water or a puddle of water and not jump into it aggressively, or there's no way he's staying dry. He just needs to be in it. And last night he was with a friend down at the ocean, but it was, I think she looked away for a second, maybe, I don't know. Or he just walked in and he was wearing his winter boots and he's up mid shin in the ocean. He just looks at her and goes, "We're cold." Yeah.
I think my favorite thing he does right now is lifts up his shirt and says, "Touch bellies." And he wants to do skin to skin with it. And you lift up your shirt and it's pretty cute.
Yeah, it's really sweet because he's babies love skin to skin, right? And I did breastfeed him, so he was used to a lot of skin to skin. But then even even after he was weaned, so when he was a year and a half old, he would get so excited if he was sitting on your lap and he lifted your shirt up. He would see a belly and like get all excited and so he never really has lost that. And now that he can communicate and like speak sentences almost, he's like he wants to continue that. So it's funny to like see how it's evolved, I guess.
I love it. Since being in like an infant, he hasn't really been a cuddler. This
Yeah.
That was a nice moment to just like snuggle a little bit.
I have noticed that he's gotten way more cuddly in the last like month or so,
Yeah.
which I love. Yeah. All right. Well, this doesn't need to be like a pregnancy and parenting podcast. We'll go on
So
with it.
yeah, the first of our 5 philosophies is that your body is adaptable. And what do we mean by that, Ashton?
Yeah. I feel like the biggest thing that maybe rubs us the wrong way is when we see someone that comes in after dealing with something for so long, a symptom, an injury, and they've been told by a provider before that like this is the way it is, or like there's nothing they can do. And that's just so like I honestly can't think of a time when that even is true. There are so many things you can do, so many ways, so many variables. There's just so much. And so for someone to say that, being in the role of being a doctor, to say that to somebody who is not a doctor and doesn't maybe know medically what's going on or how to treat something, I think is like incredibly bold and like not right. So that's not our philosophy. Our philosophy is very much that your body is used to what it's used to. And if we want it to be able to tolerate something else, you need to be able to expose it gradually over time in a way that is non-threatening to your body and that it tolerates it well. If that were an easy thing to do, we would not have jobs. Our clinic would not exist. That's a very difficult thing to do, and it's not easy. And sometimes it can be literally years. But if someone's willing and wanting to solve that problem, then like, who are we to not help guide them there?
Yeah, I feel like we have the mindset that you can always improve. I mean, that's like in general one of our like core values is just having a growth mindset, but more specifically talking about physically, you can always make your body more adapted to handle more stress, like always. And
Yeah.
so many people think that I've tried PT, maybe it helped a little bit, but it didn't fully work. It's like, well, not all PT is equal. You just probably plateaued in terms of the stimulus that you were providing. If you're not continuing to provide harder stimulus, you're going to stop adapting. If you want to be able to handle more than what you're doing, or do more with less pain, you need to keep adapting. So to us, it's always super straightforward. And I feel like when we have that conversation with people, people always get it and it makes sense to them. But for some reason, people don't like innately understand how. I think it comes down to how stressful running is on your body, like physically. While we firmly believe like anyone should just be able to go out and run, and it's not something that you should have to do like 30 minutes of exercises and have to really prep for. Like it's a very innate thing in running. Like 10,000 years ago, humans were running a lot of the time. It is very impactful on your body. And if you aren't doing much impact, then it could potentially be pretty like stressful to the point of causing symptoms. I think maybe something that can be helpful to just provide a little bit more detail around this concept of your body being adaptable is just the concept of homeostasis. So if anyone's not familiar with the term homeostasis, very on a high level standpoint, everything in nature tries to always get back to a balance point, an equilibrium point. There are so many examples of this, but I think the easiest one to think about is like your body's temperature. If you are sick, your body is trying to fight that and you're trying to get back to an even your body temperature. And it's like if you go, way outside or relatively small percent changes outside of the normal body temperature, like major things happen, right? So you have all these forces that are trying to keep you at homeostasis, but that concept is kind of also applied to our tissue tolerance from a load standpoint, where your body, your tissues adapt to what the stimulus that you're providing in. That eventually you're like, if you're not doing more, you're never going to be sore. You're not going to have pain because what you're currently doing is not too much for it. But that's only if you're in the sweet spot of how much like stress your body can actually handle.
Yeah. And like, I think maybe the one thing that's like unique about homeostasis and running is that homeostasis point can change, right? So yeah. So like with graded exposure slowly over time, like it's not something where it changes quickly, but like over a long period of time. So someone that's used to running like 10 miles a day, like to them, a 15-mile run is very different than someone that's used to running 3 or 4 miles 3 to 4 times a week, right? So it's like their tissues are just very much able to handle the demands that are being put on it.
I think one of the most helpful things that we do for people at certain stages of their rehab is helping them know like how quickly to progress running. And I think oftentimes people are either trying to progress after an injury or during later stages of injury. They're trying to progress either way too fast or way too slow. A lot of people have the 10% rule in mind. Just from everything I've seen, there's no like decreased risk of injury by progressing your volume week over week by 10% compared to 25% or random amounts. And there's so many reasons as to why that's the case. And I think that one of the biggest things that we do is help people determine what their current capacity is. And what that means is what is the approximate amount of load that you can currently handle without really aggravating certain tissues. And to do that, you really have to look back at multiple weeks of training, but also know their entire running history. Have they been a runner for 3 years? Have they been a runner for 30 years? And what is kind of like their average volume that they've done over that period of time? And how much time maybe did they have to take off or do significantly less? All those factors play so much into how quickly someone will be able to progress back up. Reasoning is that if you do less, your body adapts to doing less relatively quickly too, unfortunately. The most common time that someone has a new running overuse injury is 2 to 3 weeks after taking a week off or a down week. And the reason for that is your body adapts during that down week or that off week to doing less.
And that's not to say down weeks or off weeks are not important. Like they may definitely be, but you can't just jump back to exactly what you were doing.
Yeah.
That's oftentimes and it totally depends on like what were you doing or what was the plan for that, those 2 weeks if you hadn't had that off week or down week. But I just talked to someone that he's like, 5 at the time, I think 6 weeks out from Boston and had the flu, took 4 days off, and the next week jumped right back into training as programmed, like as scheduled. It just like clearly was not that was like the very obvious like trigger for his like new onset of knee pain.
I think tying that back to homeostasis real quick, like
Yeah.
your body is fighting an illness. Your body is trying harder to recover. Even after that, when you're trying to ramp back up training, prior to the illness, your body was already recovering from the stimulus that you're providing.
I have an illness that you're trying to recover from.
And then when you reintroduce the training, you're already recovering from too much and you're off balance. That's why it's so common. Did you have a new issue pop up?
Yeah.
Yeah.
He was super smart and was like, I want to get this treated immediately because Boston's in 5 weeks, and we got him in a few days, and I think he's doing well. Easier to treat the earlier things come.
Yeah, I love that. We have a lot of people that will just work with us like once they're doing really well, and we'll just see them once a month. And it's really hard to dig too deep of a hole in just a month.
Yeah.
Unless you get really sick and ramp back up super quickly. But usually seeing someone every month allows us to make those quick changes and prevents any like significant injuries.
Yeah.
Which is nice. I'll talk about the next one. Number 2.
Yeah. I think this is like one of your main philosophies. If I had to like choose one thing that you like, maybe not love to talk about, but always talk about with people. And that's relativity. Everything is relative. I think this is just true of life.
Yeah, I feel like we're just actually like we're so passionate around using the right language with
Mm.
people because it matters so much. There are definitely instances where maybe I'll spend a little bit too much time choosing the right words in conversation with someone where like they didn't really necessarily need that, but some people really need that. And if you miss that in your conversation with them, they're going to take away like such a different intention than what you were trying to communicate. So
100%.
yeah. So it's I think the most common there's probably two instances that are the most common for us. I'm talking about things being relative, and I think the most common one is just whenever we talk about someone, like we do strength testing and we tell someone that like this muscle or muscle group is not as strong as it could be. You could tell that I struggle to just tell someone that they're weak, because usually it's not that they're weak. Weak is relative, right?
Mm.
So I always tell someone like, you know, what percentage of the population is running or running marathons? Very, very little. So if you, as the runner who has a weak hamstring or hamstrings, if you were not trying to run very much, there's unless the activity involves running, like soccer or basketball or something like that, there's not much else that's going to stress your muscles in a similar way. So you probably don't need as much strength to live a happy, pain-free life. But because you choose to run X amount, you need to be able to tolerate more. You need to be stronger. So that's why we just try to always make sure we're saying a relative weakness. I think a lot of people respond well to that. And then that also starts connecting it towards their goals, right? If your goal is to sit on the couch all day, you probably would be fine. You might have back pain from sitting all day, but I think the second most common time that we'll kind of talk about the term relativity is with goals. And we get a lot of people that will, I think it's Theodore Roosevelt's original quote is comparison is the thief of joy. I love that. It's really, really, really hard these days with social media, especially to not compare ourselves to others. But we have people all the time who will say, yeah, I'm only running 35 miles per week. And to us, it's like that only is just not necessary. We want to dig deeper and know, like, okay, because you said only, that means that's not very much for you. But then we have tons of people that 35 miles per week is way more than they've ever done in their lives. I think that that's just the importance of really understanding someone's goals. And it's not up to us to tell them what is a lot or what isn't a lot. So I think we pride ourselves in taking people's goals super seriously. We kind of tell people all the time on our initial calls that uh, we we just don't want to take your goals more seriously than you. I don't know if you feel like you say that to some people sometimes too, right? I feel like the most common example is like when someone's like, "I'm not necessarily a runner," like, "Do you
Yeah.
still work with
Yeah.
me?"
Yeah. Of course. If as long as you know, have a goal or something that you're working towards or uh yeah, we're totally happy to help guide them there.
We just want to work with people that are motivated to get better, and we're motivated to help someone, so we don't want to care more than you about yourself.
Yeah, and I think the nature of what we do is like this is getting into another philosophy, but our treatment is not passive, so it just won't work. If somebody doesn't like want to get better and implement changes, it just won't work. And so we don't fix people. We don't like, yes, we do some hands-on work, but like do not, we're not manual based physical therapists. So um, I think that's the biggest reason for saying that is like we want you to very much know what you're signing up for. Yeah. And so I mean, depending on like what somebody like has going on, I definitely will always, you just kind of take into account what have they done before and like what is missing? Like what does it sound like they need? And it's so shocking to me like how many times that's all just new information to people. It's crazy.
Should we dig into that one?
Yeah.
Philosophy. So Ashton was kind of alluding to is active versus passive and what that means from a treatment standpoint. I think that the easiest kind of way to initially describe this philosophy is runners and people who we are working with, their issues are from being active. And to summarize it, that means that if your issue is from being active, then your solution should also be an active solution if you really want to address the root cause. So we can get nitty gritty and define what active solutions are versus passive solutions. As you were alluding to, it's not that passive solutions don't have a place. It's just a matter of recognizing what stage of rehab process you're in. So do you want to list off some passive rehab solutions?
Yeah. I would say like getting a massage, getting a chiropractic adjustment is a passive strategy. Again, not that these things are bad, but you're not doing anything actively to your body.
You're not taking it into your own hands.
Yeah. And then like things like, I mean, honestly, it can be things like, oh, like I think that is bothering me because that pair of shoes is bad. Like I'm just gonna like change that pair of shoes.
Yeah, blending shoes. Yeah.
You know, sometimes like that might be a thing that helps, right? But I would say that you're lucky if that's the only thing that you need to change and does help and solve it for good. It's not a common like long-term fix for most things. Yeah. So, and then like any that I think like cupping and like dry needling only and not following it up with like some movement and mobilization and active strategies and like
Rest.
washa or scraping. Yeah. And then like just resting, not doing anything.
If that's our biggest
Yeah.
pet peeve.
Yeah.
We get so many people that, yeah, I just either I was told to just rest it or I decided to just take a week off or a month off. And then surprise, surprise, it was still there when I started running again.
Yeah.
Digging slightly deeper into that, just real quick, when you take time off, your body adapts to doing less. So usually it's more likely to be there after that period of rest rather than actually helping. Sometimes it can help if a issue is pretty acute and it's just super irritated in the short term. Sometimes it can help, but usually there's a lot that you can be doing actively during that or taking time off if you do have to take time off. But I think the only other missing like bigger picture passive thing is kind of what you're alluding to with shoes, but in a bigger picture is like just like hoping it's going to get better on its own and not like trying to like research and learn. I think that that's such a big component of it, not only to solve for someone to solve injury that they're currently working with, but also to learn how to prevent future ones. We sometimes will tell people like we're first and foremost an education company because that is such a big part of what we do with people is try to help them learn why issues seem to be always coming on, why they keep getting injured so that they can learn how to prevent it. And there's so many factors that go into that. But yeah, I think we're just obsessed with the active process. And certainly that also means doing strength training, doing the right mobility work where you are actively being active, but it also means taking it into your own hands, being responsible for your life situation, learning, finding the right resources, not giving up. It's okay to get discouraged when you have a flare up, but don't entirely give up because you could be on the right path. You just have to push through. You need the right people to help support you with getting through flare ups. That's such a huge thing that we'll see is if someone is, say, on the right path in terms of rehab, load progression, run progression, it's really hard for them to see progress often. So having that support team that can have that a little bit more bird's eye view and say, hey, like, I know this sucks. You had another flare up, but like you recovered within a day or two. 2 months ago, you were running 10 miles per week with mild pain. Now you're running 20 miles per week with mild pain. It doesn't feel like a huge progress to you, but it definitely is compared to not running for 6 months or something like that prior. Anyway.
Yeah. I think one last thing on that point is we've like hemmed and hawed about going back and forth. Like, should we offer like dry needling sessions or just like recovery sessions? And occasionally we will like after a big race, but it's just not in alignment with like our beliefs. And like, I don't know, we go back and forth about it because like sometimes it's just what people want, like
Right.
Give people what they want. And that's fine. When it just doesn't like sit well with you because like, you know that there are so many other things for this person that they could do that could help, but that's not why they're there and they're not really like trying to open that can of worms. That it's like not yes, it's your place to like educate them and make sure that they're making a fully informed decision, but it's not really your place to decide that for them what they do. So Yeah. So we don't do that.
But we do soft tissue work, ART, dry needling.
Yeah.
Sometimes I'll use that as an opportunity to build trust with the client, give them what they want, and also slip in small education moments of, hey, like, I think we actually should figure out a way to load this area, or we should look at this, range of motion test.
Yeah.
But sometimes, like, it's so hard because so many times people have like really long standing beliefs around like what has worked for them. And, that can work really well for 30 years. And then things accumulate and you need a totally different plan of attack if you want to continue to run for a while. But
Yeah. I think, and it's not always that it's just their belief and that's only what they want. I think it's just maybe they've never met someone who's helped them in a better way.
right, totally.
So,
Yeah, because not many people take the time to correct. It's easier to tell someone that their spine is out of alignment than to go into, because people naturally have heard that so many times that like makes sense to them. But in reality, your spine is not going out of place unless maybe you had a severe car crash, something like that. Your spine is not out of place. What's actually happening is you are having a release of pressure in a joint, and that pressure creates a popping noise. And there's also chemicals that are produced when that's happening, and those are feel-good chemicals, so it can feel good afterwards. Sometimes it's also stretching joint capsules, so sometimes you have increased range of motion afterwards, but we're not putting your body back into place, right? So, man, I'm so passionate about that because it affects people's mental state a lot and makes them dependent on somebody else. And we're just we just know that helping you be empowered in your situation helps you live a better life because you don't have to be afraid of bending over and your back going out of place, right? Like if someone believes that's what's happening, they're not going to move. They're not going to lift. They're going to get into, and therefore they're going to become decrease. They're going to maladapt. They're going to adapt to doing less. They're going to get weaker. They're going to have more issues pop up, and it's such a vicious cycle that can be a process of years and years and years. But that's why language is so important, and finding someone that takes the time to make sure that you understand, asks you the right questions so that it's checking for understanding. It's checking to make sure that you understand why you're doing something and the goals of what you're doing, rather than taking the easy way out of just saying, we're just, putting your body back into place. Like, come see me, every week, every couple times a week. Fired out.
yeah.
Can talk about that forever.
Well, you're on a roll. So why don't you just go right into the next one?
Holistic.
Yeah.
Yeah. So yeah, taking a scientific, holistic approach is a big philosophy of ours.
Can I just say real quick? I think the only reason we added scientific to that is a lot of times when you hear like holistic, some people think that's great. And some people think there's some woo-woo shit going on. And like, if you're into kind of some woo-woo stuff, like that's cool. That's awesome.
Especially if it helps like from a stress relieving
yeah.
standpoint.
Oh, totally. That's fine. That's awesome.
We also look
but to say that like things you don't believe in are the things going to help you is like not the right approach. So from like a scientific evidence-based, informed standpoint, what are you talking about when you say holistic approach?
Yeah, we just look at everything, right? And we know how so many things play into injury. There are situations that it's like, yeah, this one area just got irritated for this very simple reason. Whether you just, I'd say probably the most common example is you sprain your ankle. Your brain tries to protect your ankle joint so it doesn't happen again. So it stiffens it up. The ankle joint gets stiff. And then if you're not actively working against that stiffness, more medium term, after it's kind of like the pain is and swelling potentially has resolved, you could end up having significant stiffness, and then that can lead to issues, yada, yada. So sometimes it is, okay, like let's address that ankle mobility and now everything's good. So if maybe it was just that one thing, but I'd say more often than not, there's so many factors that play into someone's injury, especially when we're talking about runners, especially when we're talking about overuse injuries. 80% of running injuries are due to training errors. what is a training error, a training, or like, what does that mean? It just means you did too much for what your body could currently handle in that moment. And there's two sides to that. There's did too much, and then for what your body currently could handle, right? So what your body can handle is recovery. How recovered are you? But also, what are you used to from a longer term standpoint? And then you did too much is we did too much on either a short term basis, like that day, or over the span of a week or two, or yeah, it's just been accumulating over the course of a longer period of like a month of doing higher activity. It just took a month of cumulative fatigue for this tissue to get overloaded to the point of having pain. Does a lot. I feel like there's a lot more to it. So
I mean, I think to give an example maybe would be helpful. So let's say someone develops like patellofemoral pain and they go to a PT and the PT looks at their strength, their mobility, their running gait, and maybe they take a peek at their training. I would argue that person could never get fully better if the root of their issue is they're incredibly stressed and the only way they can manage that is by running more. They don't sleep well and they're anxious and their sleep maybe they're like trying to get better because they know it's bad, but their quality is just terrible. And maybe there's also like a history of or like some disordered eating behaviors. Like if that is not captured and like addressed and this person is never educated on like how those things probably are very much tying into their recovery so that their body can train, then they will never fully get the help they need.
Yeah, they might resolve their symptoms in the short term, maybe it comes back, but if they don't address the root causes, like all of the root causes, they're just going to be so much more likely for that injury to come back or a new injury to come back.
And those are all big things. They're not easy fixes. But I think it's our job to just recognize when those are like big factors at play, because sometimes that means looping in other providers that are awesome that can help them with that, or just being a person that's open to listening about it. With some things, there's some like simple strategies that they can start working on, and just having like that accountability partner, I think is huge too. But yeah, those are things that I think they don't necessarily need fixing. Open someone's mind about how their training may need to change and adapt because of those variables. I think it's huge.
Yeah.
Because if they can learn how to create that balance, while all those factors are at play, then that's going to be like so helpful for them going forward with any future potential like aches or pains or injuries or things that pop up.
The non-training, non-weakness, mobility, non-gait root cause that we'll see of lots of injuries is from more on the mental side, like exercise compulsion. It's something like if you have exercise compulsion, it's like a 7 times greater risk of developing a running injury, which is insane. Makes sense though. So I think it's never up to us to fully decide what someone has to do. I think it's more, as you're alluding to, like educating them how important it is, because some people just have no idea. I do feel that urge to just go run when I'm like stressed, or I have to run every single day for me to feel like good. I think from a long-term standpoint, if your goals are to run more, or your goals are to run a certain amount that you tend to get injured at, you either have to eventually come to the conclusion and be wanting to like address that root cause and work on the exercise compulsion, as in this example, but many other things apply to this, or you have to learn and practice being flexible with your training. And that means being okay with not running every single day, or being okay with not feeling great when you start and stopping at 10 or 15 or 20 minutes rather than pushing if you normally do push, right? So those are the only two bigger picture options for somebody to like fully embrace and fully try to avoid injury from a longer term standpoint. And like I said at the start, like it's not up to us which path someone picks, but certainly helping them realize that those are huge influences on their pain, and also helping them know what potential solutions there could be out there, because some people just don't know about that either. Some people don't even recognize that they have exercise compulsion. I think one last piece on that is like, it's also so, I think if someone's goal is to run for as long as they can in their life, longevity running, I think no matter what, I think having other forms of exercise that aren't running that you truly actually enjoy are huge. So most people don't like stationary biking, stationary elliptical. So I think it's finding like I wrote a blog post on this not that long ago, but what are breaking down the reasons why you love to run, and then taking each one of those individual reasons and thinking about what other things I can do that address and help with this one thing, right? So the example is a common reason people love to run is because it's time that they can be outside, or it's alone time from their kids. Okay, what other things can I do for alone time for my kids and make time for that to scratch that itch? Or what are other ways that I can enjoy being outside, going for a hike or something like that, or just, yeah, literally playing with your kids outside, opposite of alone time. And some people just don't like take the time to think through that. Obviously, nothing is going to fully replace running, but the more you have from options that can help with that, I so strongly believe that the more likely you're going to be able to run forever and not have huge injuries that end up, preventing you from running past the age of 50 or 60, which is relatively common for people to not be able to run beyond that point.
How did flexibility not make it appear on our philosophy?
Yeah, I don't know.
I'm gonna just mark that in as number
It's
6.
It's the bonus one. Yeah, 6. Yeah, being flexible.
I mean, yeah. I think it deserves its own category.
Yeah, for sure.
It's woven into everything else.
And not to dig deep into it, but with the training and coaching app that we've been developing over the last year, Find Your Steady State.
A little plug.
A little plug.
Is this the first one?
Yeah. First what?
Plug.
Yeah. But literally the goal of that is to help people learn how to be more flexible with their training, right? Like, it's not about what your total numbers are from Monday through Sunday. It's it's looking at generally what you've been doing recently. You can go check that out if you haven't yet. It can be super helpful. There's a lot in there, so it can be a little confusing at first. But do you want to add anything else to the flexibility as the 6th?
I think you said enough on it. Yeah, it's something where if you don't truly learn to embrace being flexible, it will catch up with you at some point. Yeah, it's something where if you do embrace it, you do learn how to apply it. It's a different thing than understanding. Then it's like a way to like that. To me, that is like when we think about like we can't prevent injuries. Like injury prevention, I just like hate that term. All I can do is reduce our risk. And I'm talking about like even overuse injuries. I mean, we can't prevent traumatic injuries. Like things happen, accidents happen, right? But with overuse injuries, the more flexible we are, I would say like that is your best shot at reducing your risk of injury.
And you also, in order to like fully embrace being flexible with training, you have to really understand how your body's feeling too, so that you know like when you should be flexible. I think a lot of people struggle with that as well. Like step 1 is know when you should be flexible, and step 2 is be flexible.
Yeah, it's hard though, right?
Yeah.
Because when you're training, like I think like marathon, like right now, so many people are marathon training. They've got like spring races upcoming, and it's like, man, like I'm just feeling tired. And like to some degree, like you are, like you're probably peaking, right? Like you're doing a lot. You're in the thick of like the heaviest weeks of training. So I think it's like that is a hard thing to know. Like what is just fatigue and being tired and like maybe like being a little like mentally exhausted from the training. Like I'm like kind of ready for the training to be over. What's that versus like, okay, this is my body like giving me signs to rest. Right. So it's definitely not easy. Like it's not as like clear, cut and dry, but I mean, that's exactly when something like the app, answering your, I don't think you said this, but there's 2 pieces to it. So it's like your training data and analytics. kind of like showing you, I would say like what's maybe similar to Strava's weekly view, right? And then, but more and better. And then, and then the other piece is the recovery, which is what with like a Whoop or, your Garmin watch or Apple Watch. I think Apple does this, right? I don't have one, but like tracking your HRV. That's how most of the like current apps track your recovery and readiness. But this is,
It's not accurate because it's from your wrist. Wrist heart rate monitoring is not very accurate.
yeah. And I mean, it's wrist compared to wrist. So it's like for you, it's at least, you're looking at the same variable, right? So if it's accurate for you, it might be fairly accurate.
Right.
But the problem with that is it doesn't take into account I think the main things, especially with like runners or anybody that's like training and pushing their body at a high level, is fueling your body well, getting enough sleep, getting good quality sleep. How is your mood? How is your stress level? Like in general, how does your body feel? Because you could wake up one day and feel great, but your HRV's tanked and you're like, huh, like how many times have you heard that? And so like, do you like, okay, like let's say you have a good workout planned and otherwise like you're feeling fine. Do you like use your HRV being down to like modify that? Or like, I think it just kind of can maybe unnecessarily cloud things sometimes for some people.
Yeah, it's very simple. Go by how you feel.
Yeah. So I think but who can recall exactly how they felt 7 days ago, 14 days ago, so like having a track, and you don't have to go based on like how was yesterday or how are you today, but like in general, how have you been? Like, right. So I think that's like for someone that fully implements using the app and tracking their recovery scores regularly, like I think it's like, yeah, obviously we feel that way, like stemmed from your brain.
Yeah, I mean, it's nothing
It's all simple,
crazy.
right?
It's super simple. It's just tracking the right stuff and knowing what the right things to consider are in terms of making those training adjustments. And yeah, I think using it in both ways, right? So like sometimes you can wake up and it might say your HRV or your resting heart rate is fine, but you don't feel great. You should listen to your body and not just go by what your thing is telling. Like my watch usually tells me I can run a 2:20 marathon. I definitely can't. So obviously there's something going on there. Anyway,
I don't know, Kelton, your body's adaptable.
my goal is to run sub 2:20 marathon.
Oh, can we talk about your goals next episode?
Yeah, sure.
Okay.
Yeah, it's been fun getting more
like,
serious again.
Yeah,
It's been a while, but I love
it's
training.
been fun to see. Did we hit all of them?
Well, we didn't. I think we did, but the other one that we didn't get to is commitment to root cause. We did talk about this.
We did
throughout.
talk about that, right?
Yeah, throughout. We didn't
Okay.
like label it. So I think, yeah, just very, very briefly, their symptom resolution is not the same as like solving an issue. Do you want to touch on that?
Yeah, trying to think of like an example would be the best. Tendinopathy.
With rest. I mean, just tendinopathy with rest.
Right. So yeah. So like, let's say someone develops a high hamstring tendinopathy, and maybe it's like fairly early on. It's been like a couple weeks, and they take some time off, and their symptoms feel better. They're resting. They're not loading it, so they don't know that it's still there. But it feels better when you're not loading it. And then they get back to running and maybe they do a workout and it's like, what the hell? That's like really bad now. That really hurts. That's still there. It was never solved. It was just not loaded. So you had no idea it was hurting you. Or you had no idea that it was like still there. Yeah. It's just, so how, yeah. So our job is to recognize what is like the tissue that's like kind of not at fault, but like what is going on? What's the diagnosis? And what does that diagnosis or injury take to get better? And this is why like we specialize in treating running related injuries, because it's not like, oh, 6 to 8 weeks, you'll be better and it's fine. Like sometimes that's true, but if you're running through an injury, which you can, it might not be like, well, you're going to take 6 to 8 weeks to rehab it and then it's like good. It's like, that's not how things work. That's not realistic. That's why we teach our mom.
I feel like that example is like relatively obvious in terms of like resting and then you come back and it's still there. Like that's a very obvious example. But I think too, like another one would be you have an issue and you have soft tissue work or you foam roll or something like that. And it feels a little bit better for a little bit, but then it's kind of still there a day or two later. It makes it feel better, but it's not obviously it's not addressing like the root cause. I don't think we could wrap up a big picture philosophy conversation without just quickly also touching on this is a part of the commitment to root cause is primary versus secondary issues. We see so commonly that people will, for example, if someone has knee pain, people will have been told or believe that it's their hips that are weak or their foot that's weak or both that's weak, and they'll work on strengthening their glutes and they'll work on strengthening their feet. Both great things. But so commonly, they're completely ignoring the tissues at fault, which are getting overloaded. And that would be, depending on the knee issue, could be the joint, it could be the tendon, could be the quad or hamstring muscles, the IT band there. Those are getting overloaded. So if we want to increase the load tolerance, we increase the durability and strength and power of those tissues specifically. That's like almost always the best like long-term way to resolve that knee pain. So we may also, especially if you're able to test and see, like we might also be doing glute strengthening for the glutes or foot strengthening for the feet if they're relatively weak. But it's so important, so important for people to know the priorities. Why is that important? Because people don't have all the time in the world. People don't love to do exercises. They want to run or be active in other ways that aren't being stationary. So you only have so much time and energy to commit to this. If you are limited, you need to know the priority list. So you need to know that doing your squats for your knee durability is more important than doing your clamshells for your glute strength. If in this example, ideally, you'll be working on primary and secondary issues, but if we have to drop something one day, it's going to be the secondary things. I've seen some crazy stuff that people have been told that their foot pain is because of something in their shoulder, and it's like, no, like maybe there is some indirect connection. I think people love like sexy answers to things that are like really complex, when in reality it's just not that complex. Your foot got too much stress, so like let's increase the durability of your foot. Sure, let's look and see, like maybe your shoulder has some connect. It's a little,
That's a stretch.
That's usually a stretch. We want to work on all areas. It's just knowing the priorities. It's so important. Honestly, it is so surprising how many other providers take that approach, and it's so frustrating to me. It's like one of my life's missions, honestly, is to make more people aware that you should be improving the durability and strength of the tissue that is irritated.
Yeah. Like how many times, like what percentage of people that call with knee pain would you say they've been in PT for a while, it's not getting better, and you ask what they're doing and it's all kinds of glute stuff and like really nothing to load their knee?
Literally 90+%.
Yeah.
Sometimes they're doing loading stuff for the knee, but it's way too easy.
It's really, yeah. So I would say they're not following their knee.
It's literally 100% of the time.
Yeah.
And that obviously like not laughing and shaming like the person that's reaching out. It's that they haven't been given the right information.
Yeah, it's just sad. Like
it's so sad.
Like, how did we get there?
I think there's a spectrum in rehab of really heavily looking at biomechanics and blaming biomechanics and how you move as the reason for your issue. And then the other end of the spectrum is biomechanics don't matter. It's all about just building strength, right? And like if this is that spectrum, biomechanics and strength, I don't know, I usually say we're somewhere like here, right? Like definitely we lean towards the strength. Biomechanics can matter and we can change them sometimes. We don't usually have that be the primary thing, especially if someone's been running for a while. We're not going to just quickly change their form because that can lead to a lot of other injuries because your body's not used to that. But anyway, we're definitely more towards the strength stuff. We're not all in. There's definitely people that are like, just load it, just load it, just load it. It's like, there's a lot to consider. We're taking a scientific, holistic approach here. But yeah, I feel like every single one of these philosophies we could probably chat about for an hour.
I think about these chairs.
I like the color. They're a little deep.
So someone that is how tall
6'2".
says the chairs are a little deep. How do you think someone that's average height feels?
Well, let's see. Who bought these chairs? You did. They were at the clinic and they moved here for a reason.
I mean, the cushion's very comfortable, but
Yeah.
I can't sit. I have to like sit on my legs.
Should we plug Wayfair or whatever this is?
Should we ask if they want to sponsor the podcast because we're sitting in their chairs?
Don't tell them the ending. Well, we appreciate you guys for tuning in. If you made it this far, we'll be, I'm sure, probably every single episode, we're going to be talking about these philosophies like woven into other stuff. So it's going to come up a lot.
We can't not.
Yeah, you can't not. But it's okay because these are the things that people need to hear repeated over and over and over again.
Yeah.
So, yeah. Thanks for joining us.
Have a good day.